Mass General, Brigham and Women's, Newton Wellesley, some of Boston's biggest names in healthcare, have one big thing in common. They all belong to Partners Healthcare System, which is embroiled in a years-long fight to expand its network even further. Partners is already the state's largest healthcare system, with most of its hospitals in the Boston area, a few on the Cape and Islands, and one in Northampton. If its proposed acquisitions go through, Partners will add 3 more hospitals to its network: South Shore Hospital in Weymouth and the Hallmark Health Systems Hospital in Melrose and Medford. Today, Attorney General Martha Coakley requested that an August 5th hearing on the expansion be postponed for more than a month. But my next guest is hoping the Partners deal never goes through. Howard Grant is the president and CEO of Lahey Clinic, which has hospitals in Burlington, Lexington, and Peabody. Welcome to Greater Boston.
Thank you so much for the opportunity to be here.
Help us understand this a little bit, because your outfit has been expanding too, and you also would have liked to have taken over, acquired Emerson Hospital, which is, in a nice neighborhood with upscale clients. Is this a case of you being jealous that they got to it first?
Emily, let me take one step back. First of all, I'm here today not representing just Lahey Health System, but a coalition of institutions that have come together, including Tufts Medical Center, Beth Israel Deaconess Medical Center, Cambridge Health Alliance, and Atrius Health, a large group of physician practices. Because after we saw the proposed settlement by the Attorney General, we took a period of time to try to understand it. We actually put together a group of 35 people with literally hundreds of years of healthcare experience to spend a weekend going through the document to try to understand what has proven to be extremely complicated, we believe difficult to enforce, and very difficult for people to understand, even with people with a lot of experience.
Yeah, but I think people are having a hard time understanding it, because a couple of the hospitals that have been acquired, like South Shore, wanted to become a part of Partners. And it's the free market, and I realize this is going to be monopolistic in a way, but they wanted to join it.
So the conclusion that we came to, and I think a lot of other people who are starting to understand the proposed settlement, is that the consequence of the settlement is that the cost of health care in Massachusetts are going to continue to grow. Already Massachusetts is 36% higher in cost than the national average for care. We believe that this settlement, if allowed to go through, would result in hundreds of millions, if in fact not billions of dollars of increased cost over time.
Okay, so Partners doesn't disagree with that, as far as I understand. They agree it's going to go up, but they might say, hey, listen, your outfit, Lahey, doesn't take OBGYN, doesn't take pediatrics, doesn't take psychiatry. Some of the money losers that other groups have to take, and Medicaid.
I don't want this to be about Lahey Health,
but you're representing them too.
We actually do deliver all those services at both Winchester and Beverly Hospital. So we're actively engaged in that, and actively engaged in providing comprehensive behavioral health services that other organizations don't provide. This is about what's best for the Commonwealth. So this isn't about a group of organizations that are concerned about themselves. We're concerned about our organizations, but about our patients. We're concerned about the communities that we serve. We're concerned about the long-term consequences for the Commonwealth, because Massachusetts will not be an attractive place for anybody to come to bring jobs. The cost of care is unsustainable as it is, and if it goes up farther, it will become even more difficult over time.
But isn't there a competitive element here too, with Beth Israel, Tufts, you? I mean, you're fighting this. There's a big PR campaign, as I understand. Each has been asked to contribute about $1 million to fight the merger. I mean, so it's partly a competitive issue.
So as a lot of different stakeholders in the Commonwealth begin to understand the consequences, and frankly, I don't know why the Attorney General has slowed down the hearing, but my guess is that there are enough people who are expressing concern that it's appropriate we take more time to understand. So the Health Policy
Commission says it hasn't reviewed the Hallmark part of this
well,
yet.
Actually,
so
as we were walking in here today, I heard from somebody, I got a call that the Health Policy Commission had issued communication to the court on the subject.
I read it. I couldn't.
Well, the conclusion, there's one line on there which would be relevant to the Commonwealth of Massachusetts, that the acquisition of Hallmark and South Shore will result in permanent increases to the cost of care in the Commonwealth. And we believe ultimately that's not sustainable, and it will have deleterious effects. Meeting with some folks in the State House the other day, I tried to understand what the consequences of increased healthcare costs have been for the Commonwealth. So appreciate this. Over the last 10 years, the cost of health care in Massachusetts in the state budget has gone up by $11 billion. And at the same time, $10 billion has been taken out of the state budget for infrastructure, for roads, for educational programs in the Commonwealth, for public safety, police, fire, emergency services. So we are eroding government's ability because the cost of health care is continuing to grow at an exponential rate.
Don't a lot of people want to come to the partners groups, MGH and some of the fine hospitals, not that yours aren't,
right,
for that reason? I mean, they've got the best in the world, and the best in the world tend to charge more.
Well, Emily, let me contest that. The Attorney General's own report, which looks at publicly available data on quality, suggests that the quality of care that gets delivered across the board in Massachusetts is superb by any measure, and that there is no correlation whatsoever between the cost of care and the quality that gets delivered in Massachusetts, which is really high. So 20 years ago, there were about 130 hospitals in Massachusetts. Today, there are less than half that number of hospitals. In every one of those communities where a community institution was closed, it's the economic engine that drives that community, it's jobs for that community, it's low-cost, high-quality care for the people who live in those communities. And we believe that the consequence of this settlement is that many community institutions will become extinct. People will not have access to lower cost, comparably quality care, and that's not good long-term for the Commonwealth. So that's what the coalition is focused on. It's not about the competition that we experience every day. In fact, our quality is comparable and our cost is considerably lower, and we think that's good for the Commonwealth of Massachusetts.
But as I said earlier, your group, Leahy anyway, did want to expand and take over Emerson. I mean, all this expansion and takeover, it's part of what's happening all over the world, all over the country. So it's, I mean, is it annoying to you in a sense that Partners got there first?
Relatively speaking, Partners today is 3 times the size of any other organization in Massachusetts. With the proposed settlement, they would become 4 times the size of any other organization in Massachusetts. The cost of care, depending on which data you look at, is somewhere around 20% or more higher than everybody else in Massachusetts. And that's not sustainable for the Commonwealth, is what the bottom line is. It will have an impact on every consumer. It will have an impact on every employer. It will have an impact on the Commonwealth's ability to attract new employers. And
why are they allowing it?
Well, I suspect you have an opportunity to interview the Attorney General and to understand what the implications would be there. But we are increasingly convinced that the long-term consequence is profound. Act 224, which was encouraged by the Attorney General and the Governor to, from a regulatory perspective, make a legitimate effort in the Commonwealth to control cost. The Health Policy Commission was formed under Act 224 and includes the experts in the Commonwealth with statistical and analytical capability to assess affiliations. They've come to the conclusion on both the South Shore and Hallmark acquisitions that it would reduce competition in the Commonwealth and considerably increase costs.
All right.
So we would like a further review of the proposed settlement.
All right. Good luck to you, Howard Grant. Pleasure to have you here
Thank
today.
you very much.